Okay, so that's a good question. Basically, just to give some background, the vaccine is aimed against this protein, the well-known spike protein that is expressed on the surface of the virus. And this specific protein has mutated, and it mutates all the time. And the risk or the concern that is now raised is that the antibodies or the immune response that we acquired with the vaccine will no longer be effective against this new variant of the virus. The truth is that we don't really know. That's the truth. There has to be significant similarity between the original spike protein and this mutated one, because they're not there to give us the opportunity to fight the virus. The virus uses this protein to engage our cells and infect them. So the variation cannot be too extreme. That said, there is the possibility that the changes, although subtle, could be significant enough for the immune system to experience this as a whole new virus, and then the vaccines are no longer effective. Whether this is the case or not still remains to be tested. There's not enough evidence yet.
Let's look at Israel, what is happening here. Israel had, while dealing with 4 waves already, Israel saw a sharp fall in the numbers, first after the vaccines were introduced earlier this year, and second with the boosters, there was a spike, and then cases went down. Where are we heading now? Does anyone know where we're heading, or basically things could surge up again? Because even if you've recovered, even if you've been vaccinated and took the booster shots, apparently it may not be enough.
This is true. This is absolutely true. But there is some concern, but there's also an optimistic view of things. When we look at the coronavirus and the pandemic, it behaves like every respiratory virus pandemic would behave, with waves that rise and then come down. And when you look at the future and you try to envision how would this end one day, it's most likely not going to be because we get a fantastic vaccine, because it just doesn't work this way. And we have a lot of experience with that in viruses like the flu. The way the corona will end, at least in my view, is when we encounter this new variant that is highly effective, but is not very aggressive, meaning that people will get infected, a lot of people will get infected, but none of them will develop serious symptoms. And in a sense, that would be the way the population would really gain herd immunity, in a sense, and then the coronavirus will just fade away.
But first there was Corona, then there was Delta, now there's Omicron. Are we going to see this again and again and again for years to come?
Most likely, yes. I just think that the coronavirus, as they evolve, would be less and less aggressive. There's a balance between how aggressive a virus is and how infective this virus is. If it's highly infective and very aggressive, it is very limited to specific places, because people there's no option of getting infected and not feeling that you get sick. And as if you have no symptoms and you're infected, then you can walk around and infect other people. If a virus is very aggressive, even if it is infective, you get infected, you feel bad, you don't go outside, you don't meet people because you're sick. So in a sense, there's either highly aggressive viruses or highly infective viruses. So in my view, that maybe this new variant is the light at the end of the tunnel. This is a variant that is highly infective, but maybe not as aggressive. And this is what comes from the health authorities in South Africa. There's a lot of people that got infected, but at least they report that the symptoms were very mild.
Light at the end of the tunnel. Let's hang on to that. Professor Zvika Granot from the Hebrew University in Jerusalem, thank you very much for being with us.